DIPG Registry, I think, has been really a key part of collecting a lot of the clinical data that we've used to really understand DIPG, understand what is the real natural history over a large number of cases, what are the elements that maybe are predicting who's going to have a longer survival, and then for a certain number of patients, having the matched tissue allows you to look at the genetics and how does that impact a lot of those clinical factors. And I think that as an ongoing resource for the whole community is really critical.
Back in the beginning, the research was, well, let's try XYZ drug and see what happens because we don't know what to do. And with the development of the International Registry, the development with the SIOP-E registry, we're starting to learn the biology. So now we're focusing our attack much more precise and getting some better results as an outcome of that. So I think that I've seen the growth within the organization of we're starting to fine-tune and zero in a little better than we did in the past.
The challenges in Europe are somewhat different compared to here because we speak different languages across all the borders. We have different regulations and politics. So that's a big challenge in Europe. But that's why it's nice to be connected to the International Registry, because we can also ask, how do you do that and how do you work with that?
So I think we're beginning to see incremental progress already. We'll get those bigger leaps by doing the small incremental studies, getting some sort of result in the clinic, and then combining some of those approaches which have shown some promise, which may give us the bigger leaps. If we say that, when I started, 15 or more years ago, we were essentially at zero with our knowledge and our success in DIPG. If we think that 10 is actually curing the disease, I would say we've gone past those early numbers. I would say we're at 5 or 6 right now. We have some shots going in the clinic that might get us up to 6 or 7 or 8. And then we have some real chance to push that forward in the next 5 or 10 years.
In the end, I think it's not one single piece of the puzzle that's going to make the difference. It's going to be the whole puzzle that should be put together in the right way.